Hello, my name is Angie, and my project is on universal healthcare. What is universal healthcare? Universal healthcare is a healthcare system which provides health insurance and financial protection to all citizens no matter the circumstances. So here are some countries that have universal healthcare: Germany, New Zealand, Canada, the UK, Australia, Sweden, Italy, Iceland, Norway, Denmark, Japan, and Saskatchewan, which is a Canadian province. Universal healthcare was first achieved in Germany in the 1880s as part of a widespread system of reforms instituted by Otto von Bismarck. In the modern world, every wealthy industrialized nation, aside from the United States, offers some form of universal healthcare to its citizens. Germany's early system had both employees and employers pay into a healthcare system which was administered by local bureaus. Canadian's federal government passed the Medical Care Act in 1966, and in 1984, Canada's federal government enacted the Canada's Health Act, which was supported by all parties, and this is exactly what we see today. This medical insurance system covers prescription drugs, vision, and dental, and of course, all Canadian residents are covered. However, undocumented immigrants are provided limited services. Next is the Affordable Care Act, also known as Obamacare, which was signed by President Barack Obama on March 23, 2010. The Affordable Care Act was aimed to provide affordable health insurance coverage for all Americans. It was also designed to protect consumers from insurance company tactics that might drive up patient costs or restrict care. Now let's talk about some cons and pros. So pros here is that it's easier access for lower class citizens, and of course, the lower class needs the most help financially since they can't really support themselves. It also benefited the elderly. Until the age of 26, children can still be under their parents' insurance, and it also capped on deductible for patients and provided opportunities for health care coverage. For cons, of course, the middle and the upper class didn't benefit anyway because they earned more, and so they have to pay more. Cap on reimbursements for hospitals and medical providers, and lastly, insurance premium cost had increased. So once the Affordable Care Act was passed, more than 60 million Americans had health care insurance within the first 5 years. Young adults made up a large percentage of these newly insured people. So there was a lot of things that, benefited people in regards to the Affordable Care Act. As of early 2020, more than 37 Americans did not have health care, and 41 of those more had inadequate access to care. Health was globally accepted investment in economic and human capital growth. However, the U.S. still remains one of the countries without universal health care. The United States of America is the world's greatest health care spender, but does not have the greatest life expectancy. And why is this? Why do people in the US live shorter lives? Well, there's a lot of answers to that question. First being obesity. And then we have tobacco consumption and the lifestyles that they choose. And of course, the environmental influences. Accidents and violence can also play a part. And 68% of adults 65 or older have at least 2 chronic diseases. As we all know, the U.S. has a history of racism and discrimination, and this can also play a role too, as people can are prone to health illnesses. According to Harvard, globally people are living longer. Life expectancy has increased in 19 of 21 regions around the world. but people are spending their later years in poor health, particularly as a result of chronic diseases. And that's exactly what we see in this diagram, on this map here. People are choosing poor life choices, which can ultimately affect them in the long run. So this diagram here, we can see that the yellow is the US, and it has a great peak here compared to Austria, Germany, Sweden, Canada, and the UK. We can also see that the GDP, the gross domestic product, is 17.9%, and that the US healthcare system is not the most sufficient. Here, this is data from back from 2016, where we can see that 68 million people were uninsured, and they were uninsured because they could not afford the coverage. So let's consider some factors. We know that the GDP in the US is around 17%, and we can see there it is greater than than Switzerland and Canada and the UK. We can also see that the infant mortality rate is 6.1, and it's a big difference between these three countries. And we can also see that the average doctor salary is also very high. So there's different factors that we need to consider and make sure that it's taken into account. So let's ask ourselves some questions. Should we work to make sure everyone has health insurance, or are there better ways to improve our system? Should people have to pay whenever they use medical care through copays or deductibles to make sure that they only use what's necessary, or should medical care always be free? Should hospitals be run by government to control costs directly, or privately to keep them competing on a free market? So concluding, as we all know that universal healthcare, there is some, the end goal is to provide some type of healthcare to citizens, and that's the most important part of this. And so, universal healthcare should be a basic human right for all, and pretty much. There's some good things that comes from universal healthcare, and there's also some downfalls that we have to also consider too. And that concludes my presentation.